getting late and I got a call from Dr. Satanshu. So I guess we will start with Dr. Anjani. You start. Dada.
A very good morning to all. I would like to thank the organizers and our chief instructor for making me a part of this prestigious conference. So this was a very dear patient of ours who happily consented for this picture. And whenever she would come to the OPD, she would say, "Beta, आधी बीमारी तो डॉक्टर से बात करके ही ठीक हो जाती है," which translates into that half of the disease is cured only if the doctor speaks to the patient nicely. She was making a very good point and teaching me a life lesson that it is not only the skill, the medications, the surgery, the technology we use to treat the patient, but a very important part is played by how we make the patients feel, how much trust we can gather. Because now it's been proven that our thoughts can actually change the expression of our genes, change the proteins and the chemicals they produce. So if we think positive things, we are actually healing ourselves. So if we feel we are healed, we are actually healing. So in the next few slides, we will go over simple changes that we can make to our processes, to how we converse with the patients, to actually have delighted patients. Because a delighted patient will not only stick to you in your practice, they will get more patients, build the business, and also, more importantly, they will, their journey with the disease will be eased. So the first point of contact is social media. This is where a lot of patients are introduced to us by the means of patient reviews, educational videos. So this my colleague Dr. Isha will be speaking about later on. Now everything these days is delivered at our doorsteps. So getting an appointment with the doctor should also be easy. So make use of technology, make use of chatbots so that they can book appointments with you, reschedule the appointments and get in direct touch with you. Is your call center trained well enough to be polite to the patient? Do they listen to the patient? Are they courteous? And do they arrange a call back whenever asked for? Now, getting to a hospital. These are very small but very important things. Now, I was taking one of my family members to a multi-specialty hospital in my hometown, and I dropped them off to the reception, and it took me half an hour to actually look for a parking. And by the time we reached the doctor's office, we were all exhausted. Now, the second time I faced the same situation. The third time I took them to another hospital where there was a designated parking, a person who was guiding how to park, a person assisting with a wheelchair. So these are not deal breakers for a hospital, but yes, if these are there, it makes the experience of the patient and their family quite easy. Because see, getting an elderly patient, a wheelchair-bound patient to the hospital is a task in itself for the family. So if you have a dedicated person to guide, to pull the wheelchair and to guide them at each step, it takes a lot of mental load off the patient and their family. Now, ensuring a smooth flow from the registration up till the checkout. How do we do that? Registration, once the patient enters, if you have a single server and you have long queues, that itself indicates to the patient that the hospital is not very well managed. And that deters the patient's perception. So having 2 to 3 servers always helps, and having different lines for different categories of patients. Like what we do is tag the vulnerable patients like elderly, pregnant, and with small kids. So at each step, starting from the optometrist to the doctor consult, they are seen at priority, which saves a lot of time for them. Post-operative patients have already undergone a surgery, so they shouldn't be made to wait. So what we do is have separate slots for post-operative patients and see them quickly. New versus old patient and appointment versus walk-in patients, we should have separate slots and have a good buffers in your appointment slot so that any delays can be absorbed there. Despite best of our efforts, delays are bound to happen if you're stuck in the OR or if some technical glitch happens. Always communicate. How should the waiting room be? Well lit and comfortable. If there is a person to guide and solve the queries, that itself allays a lot of anxiety in the patients. Have a board displaying the order of consultation. So patients are not unaware when their turn is going to come. They're not getting up again and again and asking you when when the doctor is going to see me, and they're sitting comfortably. Now these are the proven behavioral principles of waiting, that idle waiting always seems longer. turn it into a value-added time. Have screens where education videos are playing, have pamphlets about eye education that they can read, and their time, and also learn in the process. Group waiting is easier. Have patients share the experiences. Tell your happy patients to share the experiences. Uncertain and unfair waiting always seems longer. So there was one of our retina patients we diagnosed in the morning as PDR and advised a laser for them. So the patient came up to me and said, "Doctor, I have a diabetologist appointment also, and my son has taken leave today itself to show me to different doctors." So what we guided him that gave him a specific time, come back after 2 hours, and at that time we'll do your laser. So by that time I was finished with my OPD. He had finished 2 of his consultation, and we comfortably finished his laser. So it was a win-win for both the parties. So communication always helps you and the patient plan their day better. So irrespective of whether the processes were good or bad, the only experience they are going to remember and the only face they are going to remember is you. The doctor is the most important link. So if we are respecting the patient, giving a good behavior, that also sets an example for our staff to behave the same way. So in our busy practices, just remember, when the patient is coming in, are we making an eye contact? Are we smiling at the patient? Are we getting up, holding doors for them? Helping the elderly from their wheelchair to the examination chair? The sweetest sound to a person is their own name. So are we addressing them by their name? Are we showing them respect? A doctor always should be a good listener. Remember their stories. A lot of their symptoms, a lot of their anxiety will be allayed only if you hear the patient, because after that they'll feel heard. There will be a lot of clues to their symptoms in the stories they are telling. And if you remember small things, that will build a very good relationship with the patient. Like one of our patients came with a retinal detachment, and he said, "I don't want to get this surgery done right now." On asking him further, he said, "It's my daughter's wedding in 2 months." So we allayed his anxiety, we explained how important the procedure was. He got the surgery done, and at each post-operative visit, we would just ask him, how the preparations coming along? How is your daughter doing? So at the end of the treatment, in his last visit, he was treated. He actually got his daughter along, and they thanked the whole team for the personalized care that they received. It was not a big thing on our part, but yes, it set a tone for a good relationship with the patient. Respect their beliefs, make them an equal party in decision, and always encourage for a second opinion in special situations. There is no shame in admitting that something is beyond our skill, and it is always good to have a second opinion or opinion of a colleague or a senior if you're in doubt. So, as important is a good surgery or treatment, communication and counseling are as important. Especially important is a positive communication. Now, if we start telling the diagnosis and focus on the negative aspects for a patient, what happens is they get into a negative spiral of thought, and they will be closed off to what we have to tell them further. So it's always good to focus on the positives so that they are encouraged to get the treatment done and to comply with the treatment. So showing them the light in the darkness always helps. One of our patients came back and said, "Doctor, when we had gone to multiple doctors before this, and we were very scared of our disease and how we're going to deal with this. But coming here, talking to everyone, we feel better. We feel better, and we feel that we can do this. We can make the journey with the disease." Open communication is as important, and at the end of the consultation, always ask, "Is there anything else you want to ask?" so that the patient can come up with more queries and they can go back satisfied. Complications are bound to happen. It is always good to be honest about them and tell them right away. Support them through all the complications, the management of the complications. This will either help them heal or accept the disease and make the journey with the disease easier for them. So happy patients will get you more patients if, number one, you're providing the standard of care which is at par with the present standards of care. Again, if there is something that you think is beyond your skill set, it's always good to tell the patient and good to have a second opinion. We as doctors should always be available for the patients, solving their queries in the diagnosis stage, during the treatment, and even after treatment. So if we are providing these two, we will have patients who will tell their neighbors and friends, "Look, I went to this doctor, I was treated well, you should go there too. And there is nothing more powerful, there is no more, publicity more powerful than the word of mouth. See, advertisements, marketing, flashy ads will get the patients into the clinic. But good treatment, standard of care, and patient-centered treatment will retain those patients and get you more patients by the word of mouth. It's also important to train your staff in compassionate care from the first person of contact to the last. It is important to do good surgeries, to give good treatment, and it is more important to help them in the follow-up care. Have, use phone calls, SMS or emails to remind them of their post-operative care, to remind them of their appointments. Make 24/7 support available so that they can reach you in case of any concerns or complications. Have feedback mechanisms in place to keep improving the services. What is not measured is not achieved. So are the patients going back delighted? There are specific measures for that. How you can do this is when you're registering new patients, just ask them who sent you. So if they are, quoting your previous patients, you know that patients going out of the clinic are going happy. Regularly collect feedback from the patients to assess the satisfaction level, and there are some key performance indicators like patient retention rates, appointment no-show rates, and patient referrals. So track improvements in the patient's experience over time. So I would like to end with this, that this small things matters, and every step matters in the patient experience. Aim towards treating the patient as a whole than just the eye, and more satisfied patients may just, lead to less diseases overall. Thank you for your time.